Don't ignore these 13 early cancer signs. It could save your life. Imagine this. What if recognizing a single subtle symptom could save your life, or the life of someone you love? The truth is, cancer often starts silently, with signs so small that they're easy to miss. But catching these signs early can make all the difference. Why this matters? Cancer is one of the leading causes of death worldwide. The good news? When detected in its early stages, survival rates improve dramatically. Being aware of these warning signs could give you the chance to act before it's too late. What you'll learn today. This guide reveals 13 critical cancer warning signs. In this first part, we'll cover 6 early signs that are often overlooked but could be life-saving. 1. Unexplained weight loss. What it is: a sudden and unintentional loss of weight, usually more than 10 pounds, without changes to diet or physical activity. How it manifests: your clothes start feeling looser, even though your eating habits haven't changed. Friends or family comment that you're looking thinner, but you don't know why. Why it happens: tumors release substances that speed up your metabolism, causing rapid fat and muscle loss. Digestive cancers, such as those in the stomach or pancreas, can disrupt the body's ability to absorb nutrients. What to do? Track your weight regularly. If you lose more than 5% of your body weight within 6 months for no clear reason, consult a doctor. Imaging tests or blood work may be necessary to investigate further. 2. Persistent fatigue. What it is: a deep, overwhelming tiredness that doesn't go away no matter how much rest you get. How it manifests: simple tasks like climbing stairs leave you feeling drained. Even after a full night's sleep, you wake up exhausted. Why it happens: blood cancers like leukemia and lymphoma disrupt normal blood cell production, leading to anemia and reduced oxygen delivery. Digestive cancers can cause slow internal bleeding, which leads to iron deficiency. What to do? If this kind of fatigue persists for several weeks, consult your doctor. A blood panel to check for anemia or markers of inflammation may be the first step. 3. Changes in moles or skin lesions. What it is: alterations in the appearance, size, or texture of a mole, or the sudden appearance of a new lesion. How it manifests: a previously harmless mole becomes asymmetrical or uneven, develops irregular edges, changes color, or starts to bleed or itch. Why it happens: skin cancers like melanoma often begin as subtle changes in existing moles or as new spots on the skin, triggered by UV exposure. What to do? Follow the ABCD rule. A. Asymmetry: one side doesn't match the other. B. Border: edges are uneven or jagged. C. Color: multiple shades or unusual colors appear. D. Diameter: larger than 6 millimeters, about the size of a pencil eraser. E. Evolution: any noticeable change over time. Consult a dermatologist immediately for a professional evaluation. 4. Persistent cough or hoarseness. What it is: a lingering cough lasting more than 3 weeks, or a hoarse voice that doesn't improve. How it manifests: you have a persistent dry cough, or you cough up mucus tinged with blood. Your voice sounds strained or raspy, and it's hard to speak without discomfort. Why it happens: lung cancer can cause a persistent cough, especially in smokers. Throat, laryngeal, or esophageal cancers may affect the vocal cords or airways. What to do? If you have a persistent cough or hoarseness, see an ENT specialist or request imaging like a chest X-ray. A bronchoscopy may be needed for further evaluation. 5. Blood in stool or urine. What it is: visible or microscopic blood appearing in stool or urine, signaling internal tissue damage. How it manifests: bright red blood in stool suggests lower digestive tract bleeding, while dark, tarry stools indicate bleeding higher up. Urine may appear pink, reddish, or have visible blood clots. Why it happens: colorectal cancer may irritate or invade the bowel lining, causing bleeding. Bladder or kidney cancers can cause blood to leak into urine. What to do? Don't dismiss blood in stool or urine. Your doctor may recommend tests such as a colonoscopy, sigmoidoscopy, or cystoscopy to investigate further. 6. Difficulty swallowing dysphagia. What it is? Trouble swallowing solids, liquids, or both. How it manifests. Food feels like it's getting stuck in your throat or chest. Swallowing becomes painful, or you frequently choke while eating. Why it happens? Esophageal cancer narrows the esophagus as tumors grow. Throat cancer can cause swelling or nerve damage that impairs swallowing. What to do? Schedule an endoscopy to visualize the esophagus and rule out serious causes. Early detection is crucial for treatment success. 7. Unexplained pain. What it is? Persistent pain that doesn't go away with rest or over-the-counter medications, especially without a clear injury or cause. How it manifests. Deep, dull bone pain that worsens at night. Abdominal or back pain that radiates to other areas, like the shoulders or hips. Localized pain where tumors may press on nerves or organs. Why it happens? Bone cancer often causes pain due to weakened bone structure or swelling. Pancreatic or liver cancers can create referred pain in areas like the back or shoulders. What to do? If pain persists for more than 2 weeks, consult a doctor. Imaging tests like X-rays, CT scan, or MRIs may help identify underlying causes. 8. Night sweats. What it is? Excessive sweating during sleep, drenching clothing and bedding, unrelated to room temperature or menopause. How it manifests. Waking up soaked in sweat multiple times per week, often accompanied by chills, fever, or a feeling of discomfort. Why it happens. Lymphoma often causes systemic symptoms like night sweats, fever, and unexplained weight loss. Hormonal changes triggered by certain cancers, such as leukemia, can disrupt temperature regulation. What to do? If night sweats persist for more than a couple of weeks, see a doctor. Blood tests, imaging, or a lymph node biopsy may be required to find the underlying cause. 9. Chronic indigestion or stomach pain. What it is? Persistent discomfort, bloating, or pain in the stomach or upper abdomen, often mistaken for acid reflux or gastritis. How it manifests. A burning sensation or a heavy, full feeling in the stomach, especially after meals. Frequent nausea, vomiting, or feeling full after eating small amounts of food. In severe cases, vomiting blood or passing black, tarry stools. Why it happens. Stomach cancer often starts with vague symptoms like indigestion or abdominal pain. Esophageal cancer may cause similar sensations, particularly after eating. What to do? If symptoms persist for more than a few weeks, consult a doctor. Tests like an upper endoscopy or imaging, e.g. CT scans, can help identify abnormalities. 10. Changes in bathroom habits. What it is? Long-term changes in bowel or urinary habits, including diarrhea, constipation, frequency, or stool shape. How it manifests. Persistent diarrhea or constipation lasting more than a month. Narrow, ribbon-like stools that indicate obstruction. An increased need to urinate, often accompanied by discomfort or pain. Why it happens. Colorectal cancer can cause partial blockages, altering stool consistency or shape. Bladder cancer irritates the bladder lining, leading to frequent urination or difficulty emptying the bladder. What to do? Don't dismiss long-term changes in bathroom habits. Tests like a colonoscopy, fecal blood test, or cystoscopy can help identify underlying causes. 11. Swollen or enlarged lymph nodes. What it is? Lymph nodes that become swollen, firm, or tender, particularly in the neck, armpits, or groin. How it manifests. A lump under the skin that may grow over time. Swollen lymph nodes without signs of infection, such as fever or redness. Why it happens. Lymphoma often begins in the lymphatic system, causing nodes to enlarge. Cancers that spread metastasize to lymph nodes can also cause swelling. What to do? Swollen lymph nodes that persist for more than a few weeks should be evaluated. A biopsy or imaging may be needed to rule out malignancies. 12. Unexplained fevers. What it is? Recurrent or prolonged fevers, 100 degrees Fahrenheit or higher, that occur without obvious signs of infection. How it manifests. You feel flushed with sweating episodes, especially at night. Fever may come and go or persist without a clear pattern. Why it happens. Lymphoma and leukemia often trigger an immune response, leading to fever. Advanced cancers may secrete substances that raise body temperature. What to do? Persistent fevers should not be ignored. Blood tests, imaging, or a biopsy may be necessary to uncover the cause. 13. Lumps or thickening under the skin. What it is? A firm lump or area of thickened tissue, often painless, that you can feel during a self-exam. How it manifests. A lump in the breast, armpit, neck, groin, or testicles. Thickened areas of tissue that feel different from the surrounding skin. Why it happens. Breast cancer often starts as a painless lump. Testicular cancer is commonly detected as a firm lump in one testicle. What to do? Perform regular self-exams and consult a doctor if you notice any new or unusual lumps. Imaging tests, like an ultrasound or mammogram, may be necessary to evaluate the lump. Conclusion: these 13 warning signs might seem small or unrelated, but they could be your body's way of signaling something serious. Early detection saves lives, and being proactive is your best defense. Take action today. Don't dismiss unusual symptoms. Share this guide with friends and family to help spread awareness. Consult your doctor if you notice anything unusual. It's always better to be safe than sorry. Together, we can make a difference by catching cancer early. Your awareness could save a life. This is Dr. Health, and I see you soon.